Hi, Dr. Yuen. It is great to have you here, and I'm so excited to speak to you today. So, thank you for meeting with me and having a conversation around women and sleep. Um, Tell me a bit about your background and how you got interested in sleep medicine.
Yeah, Monica, thank you for the opportunity. I've been involved in sleep for a very long time. And one of the major reasons I went to sleep medicine as an internist was because around that times when Women's Health Initiative began to publish one of the first studies, I had patients that were going through menopause, perimenopause. They were confused because back then there were a lot of data showing that hormonal replacement was helpful. And my colleagues in cardiology would say, well, why don't you put these women on hormones and then you don't have anything to worry about? But there was very little data supporting those suggestions. And I decided to go into a fellowship to figure out what is it about menopause that was affecting women and their sleep, and particularly were hormone replacements helpful. Of course,
Mhm.
subsequent to that is when the Women's Health Initiative did not support hormone replacement at high doses and span another decade or two trying to look at the results of what that meant for women. So I was very glad I got in at the time that I did to be able to find out a little bit more about what's going on.
No, let me expand on that. I'm so glad you brought that up because it has been a few years since the Women's Health Initiative, and there have been subsequent research published on what is, the timing, especially, right, of this treatment. So, where do we stand with that right now?
Yeah, so it was a sponsored study with estrogen being on very high doses, and the enrollment of the women at the time were about age 61, 62, a full decade typically behind when most American women may be having menopausal symptoms. And therefore, of course, the study showed that there were more detrimental effects in terms of blood clots, in terms of high risk of strokes and cardiac events relative to the benefit that these women had as subjects. However, when you compare that with the nurses' health study, where the nurses at age 50 or 51 were taking lower dose of hormones, they had some benefit. Actually, could be cardiac protective. So I think we have to be very careful with patient selection, the population, obviously the ones that had breast cancer, colon cancer, ovarian cancer histories, uh, probably ought to reconsider taking hormonal therapy, replacement therapy. However, without those risks, some women are kind of taking themselves out of the equation where they could get benefit, particularly those women that have a lot of hot flashes or definitely they feel soaked from the night sweats and that's disturbing their sleep and they're not able to get a good night's sleep. They may want to reconsider that decision, but it's individualized, certainly.
Right. So what you say is definitely women need to speak to their providers, physicians about if they want to get onto menopausal hormonal therapy. But where do we stand with regard to sleep? Because if I remember back then, I don't think they looked at sleep, but I think you're coming from the angle of having these vasomotor symptoms and actually improving the quality of sleep. But is there also some evidence to suggest that using menopausal hormone therapy will actually also help with some of the sleep disorders, as a form of treatment, perhaps?
Right. And fortunately, there have been more studies showing there are only two hormones that have been fairly well studied, so to say, right? Estrogen being one of them, estradiol, which is the biologically active portion. And then there's progesterone. And so what we do know is when there's abrupt estrogen decrease, we tend to, because estrogen has so many different areas of the brain where it can interact with. And so the abrupt withdrawal of estrogen can certainly induce the so-called vasomotor symptoms, hot flashes and night sweats during the day and during the night. And some women may wake up from the warmth first and then they experience a sweat later, enough to soak their bedclothes, and so they have to change multiple times. And then the progesterone part is what we call a sleep driver, meaning that there is the higher doses either being administered to men and women can make us sleepier or help us maintain sleep a little bit better and help us regulate the breathing process. So when both of those fluctuate or go to the lowest level, that's when a lot of women may begin to wake up more often during the night. Of course, estrogen also has a role to play in maintaining the tone of the tongue, keeping it in shape, so to speak.
Mhm.
So the fluctuation levels and also the abrupt withdrawal, for instance, some women that had surgery to remove the ovaries for various different reasons, they see abrupt drop in the estrogen levels. Lack of a better word, the tongue can become floppier over time. And so the further out we are from when we are experiencing perimenopause, we should define that, to menopausal symptoms, they're more likely they're going to have a tongue that can block the airway, right? Something that we talked about with obstructive sleep apnea. So in the past, menopause is simply defined by the lack of a period for a year. But some people have irregular periods or they have spotting every now and then. And then eventually that could lead to the absence of period. So now the earlier changes, now we classify them as, early perimenopause, and they may begin to have some of those symptoms already, but they're not quite there. So that could be a very confusing time for
Yeah.
women. Like, am I having menopause? Am I not having menopause? What is going on with my body? And some women, because of the disturbances in sleep, may have brain fog. And that's
Mhm.
very confounding given the fact that we have COVID
True.
ongoing for 5 years. And also women around, sometimes it could be, even a very, very early age, but particularly in their 40s and 50s, are having lots of questions about what is going on with my body, especially if they play different roles in the family, either being a caregiver to young ones or caregiver to their parents and holding down a job for many of us. So it's hard to know what may be disturbing our sleep.
So true. And I think women don't realize that perimenopause starts around 35. And some women start to experience, like you said, late 30s, early 40s, some of the symptoms. So I think it's important for them to pay attention to those symptoms and see if there are any changes. And that's exactly the right age where they're almost like taking care of aging parents or taking care of children. And then sleep doesn't become as important, right? Or having to look forward to like me time, a little bit of downtime. But I think it's so critical for women to understand that that's the time when changes happen. That's the time that makes them vulnerable to chronic health conditions. And again, it's this vicious cycle of not having to sleep that can lead to other, of course, conditions and stuff. How did you get interested in women's health? I'm very curious about that because, again, were you seeing a lot of women patients, or it's just naturally that's an area that you were just, even as an internist, that just simply, became more interested in?
Yeah, I think that the way, thankfully, the way medicine was taught when I was going through medical school has undergone a whole revolution
Yeah.
in that there's thankfully more attention to women's health. However, again, when I was going through my training, it tended to be more male centric.
Yeah.
And so my interest has always been, well, what about women?
Yeah.
um, so do you have any studies on women? And I think a lot of the research, the reason they were so concentrated on men is because there's that fear that, well, what if the woman's pregnant? And what about, can we affect the outcome of both the baby and the women? And there are all these hormonal changes that we don't understand and how they may interact either with a medication that we're trying to do research on. Do we have to pay attention to the menstrual cycle? It's almost like an extra layer of thought that has to go into designing a study. And therefore, they just don't run experiments on women as such. Of course, men have hormonal changes too.
Right.
And however, is seen as a safer venue to enroll men. And it is true when I was going through my training that majority of patients that we saw were men, just because again, we see a lot of obstructive sleep apnea patients, and they tend to present as loud snorers as men come in because women, either in the family or spouses or potentially kids, were letting men know that, hey, you snore very loudly and you stop breathing. So 80% of the population were men. Thankfully, that over the couple of decades since has changed. However, women still present with different symptoms compared to men across the decades. So women more often present with symptoms of insomnia,
Mhm.
with waking up more often during the night, and they don't typically complain as much about stopping breathing, um, because thankfully women tend to be, most of us, more self-aware, and they tend to present a little bit earlier in the spectrum of developing sleep apnea.
Yeah, no, that is very interesting. And again, there's so much work that is needed there, right? Even to raise awareness. And we see more and more women stepping forward, even asking, like, do I have sleep apnea? And this wouldn't have crossed their mind a few years ago. And as for the research, I think you and I know the policies, at NIH were introduced 10 years ago. There's still a lot to do there. There was a reason women were excluded, and but there's no reason not to include women anymore. And I think there's still that need to educate researchers as well, to include women in research studies and for women to participate, right, and contribute to science. Um, let's talk about some sleep problems in women. What type of sleep problems do you see? We've already talked briefly about sleep apnea, but there's insomnia, there's restless leg syndrome, and these are some of the sleep problems are more common in women. So share a bit more about these sleep problems and what starts at puberty. Some of them start at puberty, sort of, and go through.
Yeah, because the current thinking is microbiome, right? What we eat does make up a healthier immune system. So there is some research now beginning to show both in utero,
Mhm.
in the environment, the mom's body, hopefully eating healthily and so forth, can lead to a healthy microbiome. And around the time of development and puberty is, of course, when most girls and teenagers undergo a lot of hormonal changes. And depending on how she may be exposed to in the environment and stress factors and the sleep environment, for instance, then the microbiome can become more beneficial, and that can lead to healthier immune responses and hopefully better sleep. And in addition, depending on genetic factors, that's when some of the teens may inherit the risk factor for insomnia, as well as polycystic ovary syndrome. So those are two distinctly separate things. But the insomnia, because again, depending on what the young girl and of course adolescent gets subjected to, the stress sometimes can make the body more responsive to adrenaline. And we know that if we have more adrenaline on board, we might be a little bit more what we term hypervigilant. We're going to be looking out for danger more so compared to others. And sometimes these are individuals that could be more susceptible to symptoms of insomnia, which is either trouble going to sleep, trouble staying asleep, waking up multiple times, and the next day having dysfunction, couldn't concentrate, couldn't stay awake, may even have some short-term memory recall problems and the brain fog, as we talked about. And women have exhibited more symptoms of insomnia across the age groups. When the National Sleep Foundation have done the research, starting at age 6 to older, throughout the lifetime of a woman, one is more susceptible. Some studies quote 1.4 times, some studies quote twice as much risk factor compared to a man or boy at the same age group. So we think how we are wired per se, whether there's more adrenaline on board, whether we have more connections for adrenaline. It's not definitive, but there's some suggestion that that may be the case. And also the role that society put women in, again, more likely to be caregivers and tend to be multitaskers, managing different things all at once. So the stress level that a woman may be undergoing at this stage of her life does prompt more women to have this response. So their innate susceptibilities, whether some people have certain traits that would make them tend to ruminate more. So for instance, if we tend to reflect more on the day's events, how we can do things better, be more circumspect, then we may be thinking about the same thing over and over. So some of those traits, some of the physiological changes, and of course the mental stress can make women more susceptible to symptoms of insomnia. Now, around the time of teenage years, if there is any hormonal changes that may make that teen more susceptible to have so-called polycystic ovary syndrome, or PCOS for short, then there is a little bit more predominance of testosterone, male hormone in the body over the estrogen and progesterone levels, and that may cause her body to develop a different way in that there is a little bit more fat deposition around the center of the body, and especially making her more susceptible to have sleep apnea as well when breathing can repeatedly be interrupted or stopping. And that may cause her to have disturbed sleep and not feel refreshed the next day. So these are things that occur around teenage years. Now, you mentioned restless legs, which is another different syndrome entirely, but women are just simply more susceptible because all the menstrual periods with loss of blood, because iron is intrinsically linked, we don't know why, but to restless leg syndrome. And men have an advantage in that area. And particularly if there are any special diets that either are intrinsic in the family unit, either veganism, vegetarianism, or just being a good citizen and trying not to eat as much red meat and so forth, then one is more susceptible to iron deficiency. And that tends to accentuate these symptoms of discomfort, the urge to move, the compulsion to move one's legs, particularly being more challenging when we're trying to go to sleep, and if we're having more than 3 nights a week and on a more chronic basis, a month to 3 months again, then that is what we call restless leg syndrome, is the creepy crawly that we feel. I think one of my patients who was 5 years old, I think he described it best. It can occur in boys as well. And he said, I feel like there's shoulder pop going off in my legs. I have to run around to make it stop. I
Wow.
can't think of a more perfect description of that. But yeah, teenage years can be a trying time. And lastly, around teenage years is when the internal clock that now we have learned from Dr. Cascatan and others research that the clock tends to lengthen, right? Most of our internal clocks don't function at a 24-hour cycle. And particularly for teenagers, their clocks are intrinsically even longer than that. And so the combination, all these different factors can disturb a young female teen's sleep.
Mhm. No, this is very interesting what you just said. I mean, so in a way, we need to start paying attention to sleep problems very young, right? Because this actually, by the time these changes are happening, in a way, you're already predisposed in some ways during your midlife, especially for women, because having not having the proper sleep quality is now putting you at risk, not just at for you, also for your future child that might be at risk for some of these sleep problems again. And then of course the convergence of the genetics and the other things, the lifestyle changes can make it more complicated. So certainly I think I see there's a need for more education here for women to really examine sort of their lifestyle and what is it that, around them, their surroundings and their responsibilities to at least ensure they get good quality sleep. And this is something always, even when you go to, take your child to a pediatrician, they're only looking at how many hours is a child sleeping. But I think the important question is, what is the quality of their sleep? It's not how many hours. And that having the conversation carry forward, right, especially for women, into their primary care, and seeing what is the type of the quality of sleep.
Absolutely. You're so right, because very often one of the first questions we get asked as sleep medicine specialists would be, how many hours should I be sleeping? Right? Because we have all these sleep trackers, our phones, and other devices. And however, that's really not what we want to concentrate on. Is, as you said, the quality of your sleep. Not everyone needs 8 hours. Certainly within a population, we have different variations. And we also don't require the same conditions for us to sleep well. And that might be how we get conditions when we're growing up. If we tend to live in the city, we may not fall asleep when it's completely silent. And if we happen to live in a rural area, any amount of noise may disturb us, right? So we have to take into account how we were raised and what is comforting for us. And so all the sleep hygiene questions I get asked as well is like, it should be individualized. So
Mhm.
very often when there are co-sleepers is when these issues come to a fore, so to speak. Different temperature requirements, different kind of blanket requirements, noise level, absence of noise. So within each family unit, we just have to be respectful of each other's wishes, and also understanding intrinsically in our body what makes us tick.
I think we just have to do our best, right? If we can. There was a Gallup poll, speaking of sleep quality, there was the Gallup poll a few years ago, right? Or maybe it was more recent, a year within the last couple of years, which talked about, I think, sleep has become a chronic issue, or lack of sleep in the United States has, become a chronic issue. And of course, that has an economic impact, overall. Do you want to say something about that,
Yeah,
briefly?
so I think the Gallup consistently have shown, I believe it was 2024, but it was a earlier one that, not by Gallup, but I believe the National Sleep Foundation and others, and Rand had published in 2016, 2017, in regards to 1/3 of
Mhm.
Americans are not getting enough sleep. And that's pretty much across the board, either self-reported or by surveyors. That's a huge economic cost. According to Rand, it's somewhere in the hundreds of billions of dollars. And that could be comprised of either, absenteeism, just because or the number of accidents or personal costs, either medical problems that could result from the lack of sleep. And so it is a huge problem that we really should pay attention to. And I like to say in medicine, we have figured it out because we were all given this concept that the loss of sleep is your badge of honor. I can
Mhm.
function without sleep, and some people in the high tech industry, may say, I will sleep when I'm dead, or how to hack sleep so that you can sleep less and be efficient. It's like, well, maybe that's not the case. We have seen sleep loss inducing medical errors, which is definitely something that we have been working vigilantly to avoid. Then why would you encourage other industries to have this constant lack of sleep producing ill effects? So I think that the monetary amount definitely, estimate somewhere 160 to 420 billions of dollars, but loss of productivity, zoning out when you're at work, because we know that we cannot multitask.
Mhm.
Studies have shown that. And so when someone is sleep deprived and you expect that they will make good judgment, they can multitask, it's a lot. So I think that we should stop making those mistakes and definitely make sleep, good quality sleep, a priority.
Now, just something came to my mind. If we're talking about 2015 and 17 data there, I mean, we did not have social media to the extent that we have right now. So imagine the added effects of having, being on TikTok, Snapchat, or any of these other social media platforms, especially for young children, right? High school and college kids. I think that's got to be enormous, right there, the impact on them.
Yeah, and it's not draconian for the parents and pediatrician to suggest, take your phone away, put it elsewhere. It's not just a screen time. Yes, we do understand, of course, that kids need to be interactive to do schoolwork and group projects and so forth. However, on the other hand, a lot of times it's just doom scrolling, looking, checking social media. Do my friends like me? Am I just like my friends?
Right.
Yes, acceptance is important.
Mhm.
They help buoy us in forming our own identities, but it's not 24/7. So a lot of times, I believe there are studies looking at the amount of screen time a high school person may be, involved in. It could be over 8 hours a day or more. If spending that amount of time on the screen, one may not be interacting in
Right.
person with your peers, which actually is not um, firming our social support, so to speak.
Mhm.
For whatever reason, face to face interaction tends to foster those bonds a lot more avidly compared to just texting someone. Lastly, I think the only uh, negative aspect I would point out is it's surprisingly that those blue spectrum blocking goggles that we try to buy in a hurry, they don't seem to be working out as well as we were hoping they would.
Really?
So, yeah, so putting the screen away is probably still better than relying on these, blue spectrum blocking goggles, so to speak, particularly for the teens and young adults that may be using their screens a lot.
Do you get these questions in your clinic by concerned parents or, uh, about their children? Um,
Certainly, because I think that the parents who care enough to ask these questions are the ones that are obviously more involved in the, you know, education and proper rearing of their children to have good mental health and physical health. So again, most parents are well-meaning, and there is not enough literature out there to support one way or the other. The American Academy of Pediatrics certainly have put out their precision papers regarding, about an hour, half an hour before bed minimum to put the screens away and try to limit very young kids a screen time to about an hour or is slightly older to 2 hours. So I think those are guidelines. And taking into account, again, kids that do not have special needs. So there are some kids that have special needs that have no other way of communicating except through maybe a tablet device, which is more comfortable for them. So though there are some, examples that would be outside that range, but on the other hand, for those that are healthy, that are not challenged in some way, yeah, definitely less screen time. Just because a lot of times social media, although it does help us feel better, in that we feel well liked, and then there is a dopamine hit that
right.
the reward center craves. But on the other hand, we also know that there are so many filters and so many setups where people often present themselves in more positive light.
Mhm.
And then kind of catching with the Joneses is really this delusion that we may have on social media. And so it's better to step away from all of that. And on top of, the news, as we know, tends to be
Yeah.
negative as well. Then we go into this downward spiral. So yeah, very often limit your social media consumption. And if you are using it for brain stimulating activities, then we may be better off doing puzzles or Sudoku uh,
Right.
without screens.
No, this is such good advice. Um, let's shift a bit more about, let's talk about women again. And what can women do if they suspect they have, sleep problems? And when do you think that they could, they should seek diagnosis? And
Yeah,
yeah,
great questions. I think one thing that we don't emphasize enough in both men and women is that frequent nighttime urination
Mm.
aside from perimenopause, after having kids and so forth, can be a symptom of obstructive sleep apnea that we don't talk about enough. And the mechanism is it's too long and involved for me to elaborate here, but certainly that can be a sign of either insomnia or sleep apnea, causing one to become more aware of the need to urinate either after we awaken or the urge to have to go to the bathroom. So the others that we have spoke about earlier, certainly symptoms of waking up often during the night or waking up feeling unrefreshed or just plain old sleepy during the day. Now, women also tend to complain more about symptoms of fatigue compared to men. And we still don't understand why that is. Just because I like to say, if you run a marathon and it ends for you at 10 o'clock in the morning, you just want to lay on the pavement. You are for sure tired as heck. But 10 o'clock in the morning, we should not be sleepy.
Mhm.
So we have to distinguish the two and what the symptom actually is. But if you do feel fatigued, and that's not because of how much work you have done or physical fatigue, and that's persistent, well,
Mhm.
then perhaps we ought to talk to someone about it because sleep apnea may be waking you up multiple times during the night and you don't really get the rest that you're getting. And sleepiness for sure. Certainly, we don't want anyone to get to the point where they're nodding off while they're driving.
Right.
But if you do so, that is certainly a symptom that you need help. Now, I like to flip it around because when I give talks, I very often ask for volunteers like, who amongst you can go to sleep anytime, any place, anywhere? If you're one of those, come see me because you may have a problem. Yeah, not everyone does, but we shouldn't have this, unnatural ability to fall asleep at any place.
Right.
And particularly if we're talking to someone and we fall asleep. So that does not necessarily indicate that you have sleep apnea, although it can. It may also point to other syndromes, neurological disorders, something like narcolepsy, um, or something a little bit different, pardon me, idiopathic hypersomnia, where one also, despite having a prolonged night's sleep, still become very, very sleepy, interfering with our ability to function during the day. So those are some of the reasons why someone should consult a sleep specialist because you find out that you maximize, you eat the right food, you exercise, you might be consuming more caffeine, but despite all the interventions that you have, you are still very sleepy or very tired or both.
Mhm. Is it, have you heard anecdotes where people say that I'm watching TV and falling asleep? And
Certainly.
yeah, and
Yeah.
what does that tell you? Like what indicate, like right off, what do you think when
Right.
somebody's telling you that?
Yeah, we certainly have patients that don't ever have car accidents because they're sleepy, because they say, I'm a completely different person when I'm behind the wheel. I'm like, great for you, for sure.
Mhm.
However, there are people when they're inactive, so
Mhm.
either doing a so-called boring meeting, when they're in the theater, we have
Mhm.
seen people bought these expensive tickets and then ooh, they zoom out, or watching a movie or just relaxing with their family members or just by themselves watching a program, and kind of the sounds there, but they are gone. They have nodded off. And so what we think happens is that either like a third of Americans, they are not getting enough sleep on the work days or weekdays, and they have to recover some of that sleep when they are comfortable
Right.
and they are secure, and or that they might have a sleep disorder that interrupt their sleep. So their brains may not have a chance to
Mhm.
recover during sleep. And so that sleepiness pressure then gets projected into the daytime and interrupted their days.
Mhm.
Again, we tend to fight those with caffeinated beverages.
Right.
And as I said, if you're consuming more and more and they're doing less and less for you, particularly for those of you that have the evening cup of caffeinated coffee and they are not interfering with your sleep, there may be something going on there.
True. And I think people don't realize there's something called the sleep debt. Your brain actually keeps track of, the loss of sleep, right? And at one point, it should, shuts you down. So I think this is again something people need to remember and recognize. And also falling asleep in theater and watching TV is there's something going on there. Let me you know mention a couple of the symptoms that you mentioned, like the fatigue, it's such a vague term. I mean, people are used to just saying fatigue. Are you able to define it a bit more? Because it's not just the sleepiness, it's not simple tiredness. And a lot of people do feel guilty when, they're getting tired or fatigued. But it's actually more than that. Physiologically, it's more than that, right?
Yeah, it is very ill-defined. I think just because we don't know how to describe
Mhm.
that for each person. But for some, I mean, some people do have this chronic fatigue, right? Just like they do have chronic COVID, long COVID. And it is this overwhelming sense that you could not carry on the activity that you are accustomed to performing on a regular basis. That either you have to sit down, you have to lie down, there's simply a lack of energy. There are
Mhm.
just no more calories that you could expend.
Mhm.
Um, but it's highly individualized. For some people, they are fatigued, but they can climb a flight of stairs.
Mhm.
And yet for others, the only thing they can do is to lie down or go to bed. The timing may be important too. I mean, some people may not have that unless they had a meal, and then they just couldn't do anything else. But
Mhm.
very often, just because the confusion arises because the sleepiness and fatigue and the sense of fatigue tend to go together. When we are more sleepy, we tend to feel the sense of fatigue more often, and vice versa. And part of it's probably because the so-called deep sleep that we talked about, when the brain waves tend to be fairly large and fairly slow. So we also call it slow wave sleep or stage 3 sleep. When we are lacking that, we tend to feel more fatigued the next day. We're just tired because the brain didn't really get a chance to empty out all the toxins that has built up during the day. The repair products, the brain does repair itself, and it doesn't get a chance to empty out the garbage, so to speak.
Right.
Yeah. So when all those byproducts build up, we tend to not do as well, either mental function wise. So there's mental fatigue, and then there's physical fatigue. And those people that have chronic conditions that have a lot of pain as well, they are selectively gonna feel perhaps more tired or inability to use the bodies to the ways that they want to, or they have chronic pain that can interrupt sleep too.
And I'm so glad you brought up chronic pain because that's such a common symptom. And in chronic pain, the way to um, assess is functionality, right? Are the people able to function, do their daily activities? And again, fatigue is such a common thing. And one of the things I've come to realize, there's such a gap between our understanding between the connection of sleep or even sleep apnea. I'm very curious, and in relation to chronic pain. And again, I just want to preface by saying chronic pain could be a lot of the chronic pain conditions. It's just an umbrella term for all of these chronic pain conditions, which interestingly is much more common in women, especially with a condition like fibromyalgia, right? So, do you have often these conversations with your patients and see the chronic pain as a very common and I'm going right now, I'm going beyond just the fatigue symptom, is also complaints of other chronic pain conditions that come up. I know there's a connection between insomnia, at least the research has shown, between insomnia and fibromyalgia. And are you seeing more of those connections with perhaps sleep apnea or other sleep disorders?
Oh, that's a big topic.
It is a big topic,
and,
probably
and
in-depth
yeah, eh,
conversation at a different time, but yeah.
no, but thank you for bringing it up. So let me try to answer in 3 ways. I think that what we have learned thus far, uh, many researchers have tried to isolate what is causing other, certain chemical communicators in the body that are predictably causing symptoms of fatigue or worsen pain. We are not able to identify single items or multiple items and say, okay, because you have this interleukin type, which is one of the chemical communicators, and that's why you have this chronic pain. Now, having said that, of course, we know that people that have arthritic conditions, whether it is rheumatoid arthritis, whether it is another connective tissue problem called Ehlers-Danlos syndrome, that has a certain defect in the collagen that is formed in the body with hypermobility in some individuals, or psoriatic arthritis. Amongst those individuals, if they had a bad night's sleep, they perceive the pain and disability more during the day. And so we still don't quite understand the interplay why that is. But we do know if they have the normal proportion of both deep sleep and the dream cycle REM sleep when eyes move during the night, their next day's perception, despite everything else being equal, they still have the syndromes that they do, they perceive less pain and they perceive more functionality. So it is an area rich for research, even though we have understood things a lot better than we did before, that are still yet to be explained fully. We also know that certain arthritic syndromes can worsen breathing. And that includes, of course, rheumatoid arthritis if the cervical spines are more affected, and osteoarthritis tend not to affect the cervical spine as much, although if there is a slip disc, herniated disc, we can have acute pain there as well. With the hypermobility syndromes, again, that's an area that's not quite well understood. We know that some of the joints are, of course, hypermobile. They tend to get traumatized more than the others, and that might be causing some chronic pain. Albeit, so with all these syndromes, particularly with a cervical spine, ankylosing spondylitis tend to affect the lower parts of the body, but they may also have cervical spine problems. So all these syndromes, if there's acute inflammation, then that might ultimately impact on the airway by literally physically, the inflammation surrounding the upper airway that we breathe might get affected. And then it becomes this snowballing effect that if there's inflammation, there's breathing problem, then the breathing problem would then cause more inflammation, then cause more pain, more sleep disruption. So again, these are individuals that should definitely consult with their rheumatologist and other specialists to help control both the pain, discomfort, and also may, if they are having snoring and other stoppages in breathing, irregular breathing episodes, talk to a sleep specialist because we might be able to help.
No, that is, thank you for answering that. I know that was a fully loaded question, but again, I think a lot of conversation and more research is needed, at least in understanding, like you said, some of the specific biological pathways of what's happening there.
And one more point coming back to women, that we know that for postmenopausal women, the risk of inflammation for whatever reason is higher. So, and there may be resurgence, even though they may be doing quite well and symptoms are controlled, but postmenopausally, we may have a flare up. So these could be other types of connective tissue problems, or like rheumatoid arthritis, and also systemic lupus, which is a different disorder altogether, but we may have flares postmenopausally. So don't think that it's just you, but there is a higher tendency for that.
So I think bottom line, when you're approaching menopause or you've hit menopause, your risk for chronic conditions, including sleep disorders like insomnia, sleep apnea, really increase. You've lost that estrogen protection at that point. So I think having the conversation with your physician before you hit menopause and understanding what your options are to sort of minimizing, right, some of the risk factors that you might have for these conditions, I think is a great, it's a good time to have those conversations. which
Absolutely. And not all women should go on hormonal replacement. There are effective alternative medicine methods to control symptoms. And some women, luckily, may sail through without any intervention. So they are the lucky few.
let me bring this up because we're having this conversation that not everybody is, will is a candidate for hormone therapy. But also let's talk a bit about, we're both Asians. Let's talk a bit about the cultural aspects of menopause, right? Because again, some cultures it's just part of aging and nobody wants to really do anything. And you see that often in Asian populations. But also certain Asian populations or even certain racial, groups are at high risk for sleep disorders. Do you want to expand on that a bit more?
Yeah, I think that comes in two parts. Number one, at least in the population, subpopulation, I should say, in the United States that were studied, Asian American women tend to have less vasomotor symptoms, so hot flashes and obviously the heat that comes up and the sweats at night. And the Caucasian American women tend to have more experiences of these symptoms. So there may be advantage in some ways of being Asian in that regards of having fewer symptoms. But of course, it's never across the board. Individual differences exist. Now, other risk factors, though, are the Asian's jaw structure, and in that we have in some of us, maybe smaller lower jaw, and maybe the jaw is a little bit recessed,
Mhm.
and maybe what I call the human wishbone, the hyoid bone down below, is angled such a way that Asians are more susceptible to breathing problems, obstructive sleep apnea being one of them. And so while Asians may have less hot flashes and awakening from those symptoms, we may wake up more from having sleep apnea. And dry mouth is another symptom that we have not talked about yet in people lately across different ethnicities. I'm just seeing more men, women, children, and transgender as well, having more allergy symptoms, just more nasal stuffiness amongst the people that present to a sleep clinic. Um, there are people, populations that migrate across the US that have migrated into the Bay Area, and they actually do better because from the East Coast, they may have more exposure to pollen, but coming to the Bay Area, they do better with less allergy symptoms, and maybe vice versa. But there's just a sense of more nasal congestion. And that might have to do with, of course, the intrinsic Bay Area's pollen pattern, wind pattern, pollution, and microplastic concentration that we get exposed to. But in general, where you are in the world, and depending on, again, the pollution factor, that might affect how well one breathes during the day. And then the second component certainly is in our diet.
Mhm.
Across the board, there are more emphasis on eat whole foods and grains and avoid ultra processed foods simply because of the weight distribution. Selectively, these ultra processed foods, not only do we consume more of it, they're more calorie dense. We just end up eating more and more and more, and therefore the body weight tends to increase. But that's across the board in all ethnicities. The more we consume these ultra processed foods, the more likely we are going to gain body weight. And Americans, of course, tend to be overweight and steadily getting more so, affecting more generations than ever before. So the role of obesity plays in breathing problems has also, of course, increased the populations at risk.
And I think there's that inflammation component again, right? Even with these diets and stuff. So encouraging people to have whole foods or healthy foods is part of that. Having a healthy gut, which you talked about in the beginning, which again has the connection to the brain and that can interrupt your sleep. So all of these are in a way related. I want to get your opinion on when it's just a blanket statement that we make, people should just follow a healthy lifestyle. But what does that really entail? You talked a bit about the healthy diet, but what more? And sometimes when there's the fatigue aspect or pain, it's hard for people to exercise. Not everybody can just jump in and walk 3 miles a day because they're just unable to, whether it's the fatigue, the pain, and other issues. So again, diet definitely, right? I mean, what else do you say to your patients when you want to have the conversation about at least healthy lifestyle or healthy, you know?
Yeah, diet is also a little bit it should be modified, right? Because there are, for either religious reasons or for personal reasons, we also have seen a rise in irritable bowel syndrome and gluten sensitivity over time as well. So not everyone should be on a certain diet. Is what works for them without causing pain, nausea, vomiting, diarrhea, and constipation for that matter. So yeah, try to eat more greens,
Mhm.
and portion size control. Whether it's dairy, gluten, if you have sensitivity, definitely don't go there. So I think that's one aspect. Cutting down on caffeine is going to be helpful. But again, not everyone agrees. There are certain individuals that says, look, coffee without all the cream and sugar has antioxidants. So different cultural practices also have different amounts that are tolerable, depending on, again, where one grew up or what the culture encourages. So it's a negotiation. Physical exercise, again, I don't expect someone who might be overweight to go start jogging. I don't think that's healthy. It's certainly not good for those that have plantar fasciitis to walk 5 miles. And the weight does have an impact on the feet and how they react to pressure. And if we have flat arches, well, then, going on that treadmill or the elliptical is probably not going to be the thing for you. So it depends on the health condition. If there's no chest pain and other conditions that we need to be mindful of, or COPD, emphysema and so forth, or asthma that prevents you from exercising on a regular basis, definitely check with your primary care provider or physician or provider first. For those that are able to exercise, I would say, start with moving your body. For those that are tied to the desk, you may not have a chance to do anything that's sustainable for 15, 20 minutes, but walk around the water cooler, instead of grabbing a cookie or a cup of coffee, just walk and maybe talk with a colleague, encourage your social interaction. Um, while those that don't have a lot of ligament or knee problem, meniscus or torn ligaments, yeah, taking the flight stairs will be helpful. But anything that you could that's within reach. So for those that like to be reminded, yes, today is the day that I want to go for a walk. Put a pair of walking shoes next to the door. That way it's visible to you. Um, the equipment now, that Peloton is now a hanger for your clothes.
Right.
Well, maybe donate that or do something else with it, just because that visual reminder obviously did not work. So I like to just say go easy and go obvious. So if all it takes is for you to put on a different pair of shoes to go out the door, well, that's what you're going to do. Things that require traveling, that's why gym memberships, fall off after January. So you have to go somewhere to do a special
Right.
task. Well, then you may not do it. But although TikTok has a variety of different purposes, those that have healthy exercise, again, recommended not necessarily by influencers, but by really, exercise gurus that are legitimate
Mhm.
spokesperson on the type of exercise that can guide you through a 6-minute routine,
Right.
or simply for those that can walk. And I like to tell my patients, for instance, that come in that want to start exercise routines, like just start walking. But let's say, either a few minutes or 5 minutes into, if you have 15 minutes to spare, for the next 5 minutes, walk as if you're trying to catch that flight.
Hmm.
So that might help them gauge, oh, that's what it means for me. Because I certainly have people that walk for a long time, but we tend to walk at a comfortable pace. So when we do so, we may not be able to generate enough sweat for that to be healthy for our bodies, to our heart. So that's one method. And then you can slow down and then repeat again. So that is your high intensity exercise. In terms of those that can do other exercises, there are two that I talk to most of my patients about, because if you work either at home or you have an office that has a cubicle that has a wall, then I have them do the so-called wall sit, right? When you kind of rest your body against a wall and then kind of bend your knees and pretend that you're sitting down at a 90-degree angle. It takes you 30 seconds for the quadriceps to feel it. Your knees going to burn, right? And your thighs going to burn. It doesn't really take you that long to work your core. So that's exercise number one. Exercise number two, again, for those that do not have back issues, to do the elbow plank. Right. So the elbow plank is literally trying to do a push-up, but instead you rest on your entire forearm and try to keep your body straight like a rod. And that, again, in 30 seconds to a minute, you're going to feel those muscles working for you. But, consult a YouTube or TikTok to see what the proper alignment is, or have someone watch you do those exercises. But if you do the speed walking a little bit and you do one of those two exercises, and that takes you probably, 5 minutes, 1 minute for each of the two. If you can withstand them that long, that's 7 minutes in total. You got to work out.
That's great. Well, these are wonderful tips, and thank you so much. This has been a rich conversation. In conclusion, what do you have, like one message for women, or even just, people with sleep problems, and then one quick message for physicians who may not recognize that their patient has sleep problems?
I think the core message for women is don't ignore your symptoms, because women tend to be, again, playing more the caregiver role. So while you put priority for everyone else, we tend to downplay our own symptoms. If you consistently have trouble sleeping, you don't feel refreshed, you have that brain fog, talk to someone about it. I think for practitioners, similarly, do not ignore women's symptoms, right? Again, whether it's pediatrician or otherwise, I certainly have had personal experience where if I were to tell or to inform the pediatrician about the possibility of an infection in one of my kids, I might have then my husband tell the office, and he's going to get a more prompt response back. So, and I hear that still, unfortunately, from some of my patients, is that even though they may have a female provider, but they still feel as if that their symptoms are ignored. So again, from the practitioner's point of view, is like, listen to your patients, believe them when they tell you these symptoms, and do the workup accordingly.
Well, thank you for that message, and this is great. And thank you again for speaking with me today.
It's been my pleasure. Thank you, Monica.
Thank you.